So I'm Seal Zalkin. I'm president of Advocates for Children of New Jersey. It's really my pleasure to moderate today's discussion. The last 3 weeks have been unprecedented in our nation's history. Every family, every business, every individual has been affected. But to me, I think the childcare community has been hit the hardest. Certainly, you've all faced incredible challenges that really touch upon your survival as organizations. And at the same time, you've been recognized for the critical service you provide because you're what's ensuring that our essential workers who have families are able to work. 2 weeks ago, ACNJ put out a survey to childcare providers and parents. We heard from over 300 people about the impact of COVID-19 on their programs and on their families. We used your responses to advocate for changes in state-level policy and to inform what was going on in Washington to develop a stimulus package to help families and programs survive. Your voices were heard. Last week, Congress passed the CARES Act with several provisions that can help support childcare. And yesterday, the Department of Children and Families Commissioner Beyer announced a plan developed by DCF, DHS, and DOE to sustain childcare for essential workers. That information can be found on the state website, childcarenj.gov. And it talks about providing essential care. It has provisions for childcare providers, both who are open and closed, and also for parents. These are all very positive developments, but they won't help you unless you know what they are, and more importantly, how to use them. So ACNJ and its partners who are listed on this slide, and we appreciate their partnership, have committed to a series of what we intended to be Facebook Live conversations. We'll see what we'll do with the next one, to bring the experts to you, to give you the information you need and answer your questions. So today's conversation is intended to give you an overview of what you need to know about the CARES Act. It's going to be presented by Danielle Ewen of EducationCounsel in Washington, D.C. Danielle has been a longtime friend of ACNJ and New Jersey, and to us, she is the best federal expert on these issues and how to explain them in a way that we can understand. Danielle is definitely our go-to person on what is happening in Washington. Danielle will be followed by Yarrow Willman-Cole from New Jersey Citizen Action and the Time to Care Coalition. Yarrow led the successful advocacy campaign that led to New Jersey's new family leave law. And she will address questions about family leave, unemployment, and other benefits for workers. We've asked Danielle and Yarrow to present information first. We'll then open it up to your questions, which you can put in the chat box. So as questions come up, please put them in the chat box at the end, at the bottom of the screen. And we will direct your questions to Danielle and Yarrow when they're done with their presentations. Before turning things over to Danielle, I just want to acknowledge the amazing ACNJ staff who pulled this together. Cynthia Rice, Hannah Kornheilner, Patricia Canning, thank you. And one last thing, if you are not speaking, please keep your Zoom on mute so that we don't hear any background noises. And Danielle, let me now turn it over to you. Thank you.
Great, thank you, Seal, and thank you everybody for joining us. This is such a difficult time, and we're so grateful for everybody's time and attention and for all the work you're doing every day in taking care of your own families, for kids and families in your centers, and the work we're all doing to get through this moment together. Yarrow and I today are going to talk about some components of two federal bills that have been passed in the last few weeks, known as the Families First Act and the CARES Act. Each has a lot in them that relates to the childcare community, our families, our providers, ourselves, and we are all at the federal and state level still absorbing, processing, and analyzing what's in those bills. So I'm going to be able to give you some answers, and some things are just going to have to be a wait and see, or we're not sure. Just for reference, the CARES Act, the bill that passed last week, is a $2.2 trillion bill, a size of legislation that really has never been seen in decades, if ever. It was written very quickly, and we have done a lot of analysis of it, but this is still a work in progress. So the first thing I'm going to say, and I've been saying this all over the country, is if someone tells you that families or providers or programs or yourself are not eligible for something in the bill or some new benefit, please keep asking the question. Go to a different provider, go to a different agency, ask somebody else. There are so many unknowns, and guidance is coming out from all of the federal agencies hourly that we just don't know what the final answer is going to be. And so it's really too soon for anybody to say an absolute no as to whether a particular section can or will support our families, our providers, and ourselves. Agencies at the federal level and at the state level are also putting out guidance literally on a daily basis to respond to the crisis, sometimes changing the guidance from 10 o'clock in the morning until 10 o'clock at night. And that is also creating some confusion as things change. And so again, make sure that you are pushing hard to get what our families, our providers, and we need. It's important to know that the CARES Act provided significant funding to states and local communities to keep state economies and budgets intact. And we need to be making the case as advocates that the industry of childcare is a big part of that economic health at the state level, and that any state expenditures in any form must include plans to keep childcare providers whole, at least for the next few months. This will be a big push at the state level. Childcare is not explicitly named in some of these areas, although it is allowed for states to spend their money on it, and so we'll need to be making that case. Specifically, however, there are various sections of the bill that support families, providers, and programs, and Yarrow and I are going to talk about several of those. I'm going to quickly talk about some of the big categories, and then I'll give you some specific. I'm also going to apologize in advance because there are a lot of numbers and a lot of details that are hard to absorb. I've had to read multiple things many times. So feel free to ask me lots of questions about what I'm going to say, and I'll try to be as specific as possible.
Well,
but just to start,
coronavirus.
And if folks can go ahead and mute their phones, that'd be great. Just to start, there are individual supports for people who are working and not working. These include unemployment insurance expansion and a new federal unemployment program called Pandemic Unemployment Insurance, which is available to people who might otherwise not have been eligible for unemployment. The bill provides an additional $600 per person to their unemployment benefit that the state will already pay for 4 months. There's also paid leave, as Yarrow is going to discuss. There is some language around Medicaid. There are the rebates that have been discussed that are going to families, where families will receive up to $1,200 per individual up to a certain income, and child tax credits, where families with children will all receive $500 per child up to children age 16. There's also lots of information about small business loans that can be forgiven that I'll talk about. Specifically for the early childhood community, the CARES Act allocated $3.5 billion for the Child Care and Development Block Grant, which is the primary support for the childcare world, particularly for families that need help paying for childcare. It also includes $750 million for Head Start, of which $500 million can be used for summer programs to address some of the learning loss that our kids are having right now. Early childhood can also be supported through other areas of the bill, and those will be state decisions, but that includes public housing, some of the supports available for the K-12 community, and within higher education. If we have folks that are in higher education and they need support paying for childcare, the CARES Act does have some funds to do that. There are also, for the childcare industry, program and business supports, as I said, through CCDBG and Head Start, which I'm going to talk about, but also through the small business loans, which will be available to for and not-for-profit businesses that are 501c3s. There's also $1 billion for the Community Services Block Grant and $900 million for low-income home energy assistance programs to help support children and families in our communities and our providers. Again, there's lots of pieces in the bill that are designed to help keep people whole for as long as possible. There are rent and mortgage supports that will support programs and providers as well. We have been told by members of Congress that they believe the majority of these funds will go out immediately and as quickly as possible. The family rebates, the $1,200 per individual, are scheduled to be out to all eligible families by the end of April, if not before. That could change, but that is the promise that was made at the beginning of this process by Secretary Mnuchin. SBA loans are available starting today to some eligible entities and fully available by next week. Those loans will be available through local banks and credit unions in your communities rather than application directly to the federal agency in order to expedite those loan funds into the hands of providers and other businesses. And CCDBG funds, the subsidy program, will be available to states as soon as possible, and the government is working on that right now. So let me talk a little bit about our core programs, CCDBG and Head Start, and how they can be supporting children, families, and providers. And then I'll talk about the loan programs and some other pieces of the CARES Act. For those core programs, CCDBG and Head Start, states are already using, states across the country, some of these will apply to New Jersey and some could apply in the future. States are already using the significant flexibility in the Act to provide as much support to essential workers and their families, as well as to providers who have to close and those who may stay open as possible. States have many choices to help providers stay in business, and some of these may need some advocacy with your state agency, but they include paying for enrollment over attendance, even if providers are closed, providing grants to maintain the supply to ensure providers can reopen. In other words, your state can give what's called a supply building grant to providers so that when this crisis is over, we have childcare in underserved communities. They can put those grants in place to ensure that supply is there. States are allowed to provide incentives, tiered reimbursement, and higher rates to providers who are serving essential personnel and are open during this difficult time. They can waive copays and fill in the gaps in the rate that is paid to providers. They can use what's called presumptive eligibility to quickly serve new families and bring them into the system. They can waive income requirements under the bill. So again, whereas a month ago, a family might not have been eligible because they have income that was above the state limits, today they can still get support because the Act clearly waives those income requirements. States can also use emergency licensing and monitoring to set up programs that will best meet the needs of essential personnel, but we are urging them to make sure that they make sure those licensing requirements that keep kids safe are still in place. And so that providers stay eligible to serve kids, states can also utilize online training to meet any provider requirements for professional development. We're also looking at other programs to serve families and to use the flexibility there. A number of states are looking at TANF, the Temporary Assistance for Needy Families program, which provides public assistance. That program can provide immediate emergency assistance to families who need short-term help. Home visiting programs can be supported by Medicaid and through telehealth mechanisms. And in many states, there are materials sitting in closed schools that could help to provide the supplies needed for childcare programs that are still open. So some places to look for flexibility. One of the other core roles we'll need to play is as a liaison for helping everybody understand what is available through the federal program on the loan and grant side. And I'm going to talk about that a little bit. As we're thinking about it, it's important to remember that what I'm talking about applies to both centers and to family child care. So let me talk a little bit about the various programs. The first one that is out there to think about as a provider, as you're thinking about your economic health and continuing to find a path forward, all of these need to be thought about together. But I'm going to talk about that. So the first one is called the payroll tax deferral. Employers can choose to defer their payroll tax payment now and use that cash flow to pay their payroll, cover paid leave expenditures, and so on. These funds will need to be paid back over a 2-year period that ends in December of 2022. The payroll tax deferral cannot be used if the loan forgiveness program is accessed, so hold that in mind for a second. A second piece is called the employee retention credit. Employers who are shut down or have a 50% drop in income but choose to pay their staff are eligible for a tax credit equal to 50% of those wages, including payment for healthcare benefits. And again, this tax credit cannot be used if the loan forgiveness program is accessed. So let me talk about that loan forgiveness program. It is for small businesses. It is being called the Paycheck Protection Program. So if you're going to an institution and asking for a loan, you're asking for it under the Paycheck Protection Program. And now in our community, when I say the word loan, a lot of our providers, a lot of our small businesses are very fearful about taking out loans. So if this is you, please keep listening, because there's a really important component to this loan, which is that it can be forgiven and will be forgiven, and you will have no liability. The Paycheck Protection Program is available to both for-profit and not-for-profit organizations. The full amount of the loan can be forgiven if employers use the funds only for payroll, utilities, mortgage or rent, and healthcare cost benefits over the 8-week period after the loan is given. Funds are available from today, April 3rd, through June 30th. The application should have minimal requirements for eligibility. For instance, there is no need to provide collateral, there is no credit check or personal guarantee. To qualify for loan forgiveness, the employer cannot reduce the payroll by more than 25% of what it has been. And for centers or other small businesses who have closed and laid off or furloughed employees, you can qualify for the loan forgiveness if you bring those staff back within 30 days and pay them through June 30th. Any portion of the loan that is not immediately forgiven is immediately turned into a 2-year loan, but the interest level is 0.5%, and loan payments will be deferred for 6 months. So this is an opportunity to bring money in that can really cover some of those expenses. The second piece that can be used to pay expenses immediately are called economic injury disaster loans, or EIDLs. These are immediate assistance through loans. There is the opportunity on the EIDL to apply for a $10,000 emergency grant, which should be available within 3 days of the application and is not a loan. It is a full grant. If a program receives this grant and also a payroll protection loan, the $10,000 will be included in the amount forgiven. It will offset. So there are real opportunities to bring money into programs today to address some of the issues that you're having. But having said that, I am not Pollyanna. There are still significant gaps, and we know that. And at the federal level, we're working to address them. So immigrant families are left out of many of the supports and will be impacted deeply by this crisis, and we'll have to find state and local funds, philanthropic funds, and others to cover their needs. The food benefit, SNAP, the amount of the benefit was not increased, and so families who were struggling to pay for food before will still have those limited benefits available, but they are still available. We are all concerned about the physical and mental health of the children and families we serve, especially those most at risk from violence, trauma, housing, and food instability, and those will have to be addressed through our programs down the line. And most importantly, we know that there is not enough money in the bill to cover the full range of need, especially if the lockdowns continue for several months. Therefore, we are already hearing from Speaker Pelosi and others that they want to do another piece of legislation very quickly that will address the needs of families most at risk in this environment. To be successful in getting money for childcare providers, for our families, and for ourselves into that bill, we will need to collect stories and understand the impact of what the current bill has done and what is still needed, and to quantify what families will need moving forward. I'm going to stop there, and I'll answer questions at the end. Thank you very much. Yarrow?
Yeah, thank you, Danielle. That was a lot of really helpful information. Some of it was new to me, so thank you. Hi, everybody. My name is Yarrow. I'm the Workplace Justice Director at New Jersey Citizen Action, and I'm going to go through, as Danielle mentioned, the opportunities for people to seek some income support or paid leave. So I'm going to first just kind of give you guys a context of what we have here in New Jersey, because New Jersey really has quite a robust set of supports and protections in place. Prior to this emergency already, we were one of just a few states that had an earned sick leave law that included coverage for public health emergencies. We also have temporary disability and family leave insurance that provide partial wages when workers are out of work to deal with their own health or their loved one's health. And those benefits in the state are going to be expanding soon. And then, of course, with the federal stimulus, there's kind of additional opportunities. So I'm going to go through those. And starting first with the earned sick leave law, this is called officially the New Jersey Earned Sick and Safe Days Law. And this has been in effect since October of 2018. And it covers employers of all sizes for all full-time, part-time, temporary workers, regardless of immigration status. And it requires all New Jersey employers to provide 5 job-protected paid sick days, or 40 hours a year. And employers can opt to provide those days up front or have their employees earn them. So for every 30 hours that they work, they would earn 1 hour of earned sick time. So the uses that are required to be permitted under the Earned Sick Leave Law are for one's own health. That can include preventative care, diagnosis, and also caring for a loved one's health, same thing, preventative, seeking diagnosis. Also for issues related to domestic or sexual violence, and for work and school closures because of a public health emergency. It was recently expanded to include issues related to isolation or quarantine during a public health emergency for one's own self, and also to care for family members who are in isolation or quarantine. And as I said before, this is for all employers. There are a few exemptions for some workers. Per diem health workers are currently exempt, construction workers with a collective bargaining agreement, and public workers that have paid sick days already. And I share all this information with you, not just for your own, your own your childcare situation, but also in case this is information that's valuable to your friends or family as well in different types of employment. So if you have any specific questions about the state law, that would be at the New Jersey Department of Labor's website, which is mysickdays.nj.gov. So you can go to that website for more details on the state earned sick leave law. But okay, I'll tell you now about the federal paid sick days for public health emergencies. So this, as Danielle mentioned, is part of the Families First Coronavirus Response Act. So prior to the CARES Act, that was the one that was passed a few weeks ago, but it actually became effective this past Wednesday on April 1st. So employers are now required to pay 80 hours of paid sick time for reasons related to COVID-19 when the worker is complying with federal, state, or local quarantine or isolation order, advised by a healthcare provider to self-quarantine, and if they're experiencing symptoms, seeking medical diagnosis, and if they're caring for individuals who are supposed to be quarantined or seeking diagnosis, and caring for children whose school or place of care is closed. So the employer must pay the employees at their regular rate up to a maximum payment of $511 a day, or $5,110 in total for your own health. And if it's to care for a loved one, a family member, it's at 2/3 of the average wage with a maximum of $200 a day, or $2,000 total when it's for family care, caring for others. And the idea is that employers receive 100% payroll tax credit, which would include any costs for health insurance. And the details on that, as Danielle said, are still we're waiting to hear from the IRS in terms of some of the details and how employers will file for that reimbursement. But we know a couple things. First, that there are exemptions for employers that have over 500 employees. And also for some small businesses under 500, they could be exempt for the portion that provides leave for kids' school closings. Those employers would have to apply for an exemption, basically saying that those payments could jeopardize the viability of their business. And additionally, we also know that the leave pay is also available for self-employed via the tax credit as well. And a couple of just things I want to mention about that. The sick time under this bill is in addition to the state earned sick leave law and any employer provided leave. And the employer cannot require an employee to use their own PTO or earned time, vacation time before emergency time if they have a qualifying reason to take the paid sick time. Also, employers can't require an employee to find replacement workers. So that's sort of the gist of the federal paid sick days for public health emergencies. But there was also an additional component we call paid leave, but it's Emergency Family and Medical Leave Act expansion. And this is required for all employees that have been employed for at least 30 days by their employer. And the employer is required to provide 10 weeks of job protected leave if they have more than 25 employees, when an employee is unable to work or telework because their child's school or place of care is closed during this public health emergency. And it requires that the employer pays the worker 2/3 of their wage, up to $200 a day, with a cap of $12,000 total. Again, the employer receives 100% payroll tax credit, including health insurance. And the exemption is also for employers with 500 employees. And then again, small businesses under 50 could apply for an exemption because of a hardship. And additionally, self-employed individuals could also apply for this tax credit if they have a qualified reason for a kid's school closing requiring them to take leave. So there is a website, we can share the link with you in follow-up, that has the notice that the employer is supposed to provide starting, the first on Wednesday. They can either post it or email it or direct mail the notice to all employees to tell them about what is available to them and how it works. Another thing for both of these federal programs, the employer is not able to discipline or discharge or discriminate against any employee who lawfully is taking their paid sick leave or the expanded family medical leave. And so just to combine total, the idea is it could provide for an individual who needs to take leave for a school closure 12 weeks. So the idea is the first 2 weeks they could access, assuming they're covered by the emergency paid sick days, and then the 10 weeks of emergency FMLA leave. And part-time employees would also be eligible, but the number of hours that the employee is normally scheduled to work over that period, that first 2 weeks, not the 80 hours necessarily, is what they'd be covered for. And it's the U.S. Department of Labor who has the authority to kind of oversee this. And so some of the details we're still kind of waiting to hear. And so there might be some nuances to how this is going to be implemented that could affect folks. So I'm going to move out of the federal piece in terms of the paid sick days and the paid family leave piece and tell you about what we already have. As I mentioned at the beginning, New Jersey's Family Leave Insurance Program. So this is a state fund, right? So workers pay into this program through payroll taxes. And this provides workers with 66% of their average weekly wage with a weekly cap of $667 a week. And then in July, it goes up to 85% of their average weekly wage with a cap of $881. There may be some advocacy efforts to make that expansion take effect sooner, so stay tuned if that happens. But family leave insurance is available to bond with a new child in the first year after birth, adoption, or foster, as well as care for seriously ill loved ones, and that includes now with expanded law that Murphy signed into law, I think last week. It includes a family member that is diagnosed or suspected of exposure of COVID-19 or a communicable disease, and then they have a recommendation from their doctor to be in isolation or quarantine. And that is available currently for 6 weeks. In July, it will double to 12 consecutive weeks or 56 days, and it can be used intermittently as well. The eligibility for family leave insurance is just that someone has to have worked 20 weeks and earned $200 in those 20 weeks at any covered New Jersey employer in about the 18 months before they take leave, or about $10,000 that they have had to have earned at any New Jersey covered employer. And they would apply to the State Department of Labor to seek those funds. They do have to inform the employer of their desire to do this, and the employer is also supposed to let the individual know when they learn of any reason that is covered under the law that they would be qualified for. And in addition to New Jersey Family Leave Insurance, we also have a New Jersey Temporary Disability Insurance Program. So this is available, again, the same qualifications. You have to have worked 20 weeks and earn $200 in those 20 weeks, $10,000 in the 18 months before you take leave. And it, again, provides the same amount of wages, 66% with the same caps as I described for family leave insurance. But it's something that you take for yourself. And you do need a medical care provider to certify that you need to take leave. And it can include pregnancy as well, leading up to your due date and after. And there's a couple of important things that have happened because of the expansion, including isolation or self-quarantine for reasons related to COVID-19. And also, a medical care provider could certify the individual's health situation, and their workplace requires that they take leave, essentially if they have a pre-existing condition. And I've heard that pregnancy could qualify you for expanded beyond the typical duration of a disability, depending on the workplace, and if the doctor is concerned about exposing you to whatever's happening at the workplace. There are exemptions for municipal and county employees. So many public school teachers don't have the temporary disability program, and it is available up to 26 weeks in a 12-month period. Some employers can provide a private temporary disability program, but it has to have the same standards as the state public program. I know there's a lot of information, so please check out online if you have more questions, if you need to apply, myleavebenefits.nj.gov. Again, it's the New Jersey Department of Labor and Workforce Development, their Division of Temporary Disability and Family Leave Insurance, where you apply. And it's really important now to apply online for quicker processing of your claim. Okay, so that's the federal and the state paid leave programs. I'm going to tell you a little bit about what's happening, as Danielle already mentioned some, in terms of New Jersey's unemployment insurance. So again, unemployment insurance is administered through the state, and in New Jersey, it's the Department of Labor and Workforce Development. And frankly speaking, they've been overwhelmed. So in the last 2 weeks, there's over 362,000 unemployment claims filed. So that's a lot, historic numbers. So what it provides is 60% of workers' average weekly wage. And this is, again, just to be clear, during a temporary layoff, a furlough, anything like that. And you're also qualified to apply for unemployment insurance if you've dropped below 80% of your normal hours. So just for reduced or lost hours, you could also apply for unemployment insurance. So again, it provides 60% of average weekly wage with a cap of $713 a week, and you can increase your benefit 7% for your first dependent or 4% for each of the next 2 dependents. And the federal stimulus, part of the CARES package, is going to provide an additional $600 a week. And that could be in people's, however they receive their unemployment. And it sounds like it's going to be a separate payment, but it's going to be as early as next week that people will start to see that additional money. In New Jersey, unemployment is available for 26 weeks, but the federal stimulus is going to actually allow for an additional 13 weeks of benefits, so for a total of 39 weeks. So that means people that may have exhausted their unemployment and, of course, are having trouble finding a job during this crisis could be eligible for those additional weeks, as long as they've exhausted the unemployment, I think, in the past 8 months, give or take. Again, eligibility for this program is that you have to have earned you have to work 20 weeks and earn $200 a week or $10,000 in that period before being eligible for unemployment. And you can apply as a self-employee as well. If you get a W-2, you can apply for unemployment insurance as well. So the expanded unemployment insurance. So this is a new thing that is also part of the CARES stimulus package. They're calling it the Pandemic Unemployment Assistance. And this has not yet been released. It's not yet available to workers in New Jersey, but it will be soon. The New Jersey Department of Labor is waiting for guidelines from the U.S. Department of Labor. But at this point, what we know is that it will be available for workers who are typically not eligible for regular unemployment. So that's self-employees, freelancers, independent contractors, some gig workers, those who are just seeking part-time employment, people who don't have sufficient work history, so they haven't earned those 20 weeks at $200 a week. So those people would go through this program through still the New Jersey Department of Labor once they kind of explain how that's going to work. I have heard that they've been recommending people who don't think they're eligible through the standard regular unemployment insurance, but think they will be eligible for this expansion. They apply go ahead and apply for the regular unemployment insurance and actually get that denial. And that will kind of get folks ready to go into this new program once it's ready and up to being on the website and people understand the official process. That's what I've heard the Department of Labor is officially telling people. And it's also something that they recommend for gig workers who are often like misclassified anyways. So they do say, apply for regular unemployment, because there is a broad definition of employment and they could potentially be deemed eligible for the regular employment. I forgot to mention, the expanded unemployment insurance is just paid at 1/2 of the state average benefits of unemployment, which I don't have that figure for, but it's around $200, give or take. And then there will be the additional $600 a week in that federal payment through that stimulus. Again, it'll just be paid through the same way you're getting the unemployment through the New Jersey Department of Labor with that additional $600 a week. And it actually is retroactive from January 27th, and will be available potentially up to the end of this year. You do have to have work authorization to apply for unemployment, even the expanded unemployment. Just folks have to see in terms of if they're a DACA or TPS, if they have work authorization at the time that they lost their job, they could potentially be eligible, but currently undocumented immigrants are not. There is one other thing I just want to mention before I move on and finish up my presentation, is that workman's compensation might be available for individuals who are exposed and get sick at the job. And that might be something that people need to look into if that's the reason that they are unable to work. So I just wanted to note a few things in terms of unemployment insurance because of the fact that the system is overloaded. The Department of Labor has posted information in terms of when you would apply during the day at a certain time of the day based on your Social Security number. So go on the website, and the website is myunemployment.nj.gov. And you can actually see the schedule of the time of day that they recommend that you apply. They also have specific guidance in terms of people who are on unemployment because of COVID-19 and a certain way that you answer some of the questions. And that is really important because that'll help your claim be processed smoothly. For example, people are confused sometimes if they're on a temporary layoff, the question about being available and willing and able to work. They recommend that you answer yes, even though, of course, everyone is sort of just waiting till they understand when their position might be reopened, right? So that explanation is on the website. I also just want to note that there is a new jobs portal that the department has published, which is jobs.covid19.nj.gov for anyone that still is looking for some work. So that's something to keep in mind. And the Department of Labor has also published some really great materials providing an overview of New Jersey's benefits and the different options that I just went through in terms of paid leave or unemployment. And they talk about different scenarios that people are dealing with because of COVID-19, and that is on their website. And they also have another explainer about the Families First Corona, the federal piece and how it interacts with our state laws. And we can share that link. I'll actually post it in the chat if that's helpful. And that's really kind of all I have. I do have a Share Your Story bit.ly link you can see there. And that's just trying to collect different scenarios and situations that workers are going through. Maybe they're still working, but they feel that the workplaces are unsafe and they have concerns about that, or what the hardship they're facing because they haven't been able to get approved for unemployment, or they don't know what is available to them. So that's a place that people can go and leave their story so we can understand the different issues people are faced with. And then I just have all these resources and links for folks if they want some more information. And I just wanted to note there are a few relief funds that are going to help some workers that, for whatever reason, undocumented or not, are not eligible for some of this support. And so there's the United Way and Domestic Workers and Rock United relief funds. And that's it.
Thank you, Yarrow, and thank you, Danielle, for two great presentations. I've been monitoring the questions as we have done the presentations, and there are a lot of questions. I just want to say a couple of things. One, some are very specific to state policy. I'm not sure we can answer them all today, but we're going to take every one of your questions and follow up on it if they cannot be answered during this call. Two, there are a couple of questions about sharing the slides. We will make them available on our website. I'm not sure that we have the capacity to email this all out to you because, quite honestly, I'm not sure how Zoom works that way. But at a minimum, we will post all the information on our website, so you'll have access to that, the slides. And in looking through the questions, I know Danielle and Yarrow have been answering some of them as they've gone along and have cited other sites for information. We'll make sure that all of that is included. Somewhere in the middle, there was a question about information versus guidance. And I think that's a terrific question because there's been so much information that has come out. It is incredibly confusing. Some of it is also based on what is our state actually going to opt to do or not do. And I understand that issue of not just tell me what's available, but what's the best approach. Can you help me make the decisions as to what I need to do? And I think that's something we're very well aware of. We've heard from many providers over the last several weeks. And I think this is something that a number of people are working on. Stick with us. We have other, hopefully if they work, Facebook Live presentations planned to get into some of this information more specifically. We have one planned for Monday to talk more deeply about the loans, the business loans, and also about some of the childcare subsidy policy. But again, I don't think all the questions are going to be answered in these calls, but I'm committing to you that we're going to take those, see what we can do to answer them, get information back to you, and raise them as issues with the state, because the state needs to hear these questions coming up to make sure that they get out. First, they resolve them and get out the guidance. So I'm going to start at the top with the first questions that came in and go through them. I'm just going to ask Danielle and Yarrow to jump in when it's appropriate for you. Again, I know you've answered some of these as they've gone away. So first question was about, what if a center is already closed? Can they apply for a small business loan to pay for rent, property tax, utilities, etc.?
We believe yes. They need to be paying payroll to get the full amount of the loan forgiveness. And the financial institution will explain that to them, but they should go and talk to financial institutions today. We've already heard that millions of applications have been put in. We've also heard, and I saw this in the chat, that there are some banks and credit unions that are saying they're not going to participate or they don't want to serve folks. I posted a list of on the Small Business Administration's website where you can find financial institutions that are participating. That will be changing and adding over the days, and SBA will be putting out guidance to institutions saying that they likely, I would expect, they will put out guidance saying they're not supposed to be picking and choosing. They're just supposed to be processing the applications. I can't guarantee that last part, but the SBA list will show you some places where you can apply.
Thanks, Danielle. Yarrow, you may have answered this question. Sorry, I just lost all the questions. They disappeared from my screen. Okay. Yarrow, you may have asked this, but that $600 a month additional unemployment, is that for providers or employers too? Employees too?
Well, my understanding is if someone is able to apply for unemployment as a self-employed individual, they would be eligible for that $600. And for anyone, staff, whomever, who's eligible for unemployment.
Okay. Can the supply grants be used for creating new facilities? Can money be used for facilities or just for supplies?
So the supply grants can be used, supply building grants can't be used for anything related to construction. We believe they can be used for minor renovations. They can absolutely, both the supply building grants and other grants the state should be making available through the new money can be used for cleaning and other expenses related to the COVID crisis. So it depends what we mean by facilities, Seal.
Okay. A question came up, and again, I think this is in the guidance categories. What's the trade-off between having staff go on unemployment, which for many individuals will mean added income, versus using the loan funds to stay open?
I have heard this from a lot of people. It's going to depend on your personal economic situation. There are folks that are going to try, you know, the intent of the payroll protection program was exactly what's in the name, to keep people employed as long as possible and keep them from having to use unemployment benefits. If this goes on for a long, long time, it's possible that both will have to be used by individual employees. I can't tell you whether it's better to use the payroll protection program today and then let your folks go to unemployment versus having them on unemployment today. It really depends on your personal situation. I will say that that the loan will help you pay your mortgage and utilities and other things, and that having payroll costs as part of that is a big piece of the forgiveness. And so there may be a cost benefit there that you end up keeping. You can pay other expenses because you keep people on your payroll for those 8 weeks. I know that's not as clear and straightforward as people are looking for, but that's the best we can do. Yarrow, I don't know if you have other things you'd want to add to that.
Yeah, I think you're right.
Okay. We have a couple of questions about the continuation of subsidy payments to centers that close. Will that be based on enrollment? How far will it extend? I saw these questions as the presentations were going on, and I went to the state's ChildCare NJ website, and it is not addressed there. We have seen through emails that DHS does have a policy of continuing to pay, but I'm not going to say that unless we can verify that in writing. So this is an issue we'll follow up on immediately. It's my understanding that the state will continue to pay full subsidy for centers that close based on enrollment, not attendance, but we're going to verify that in writing for everyone. A question about childcare provided in the public schools. That are school employees that provide aftercare program, are they eligible for unemployment? Because even though they're being paid by the school, they're losing additional income that they would get through the childcare program.
Yeah, I think the only information in terms of eligibility for just reduced hours is that they have to be working, they have to be losing at least 20% of what they regularly would be earning. So that's my understanding. I think like anything, it doesn't hurt to apply, you know?
Okay, thank you, Yarrow. I think that's good advice. A question about the interest on the payroll protection can be as high as 4%. They've heard that it can be as high as 4%. And it might not be forgiven. Has anyone heard anything about that?
So I saw that question in the chat, and I went on a number of websites while Yarrow was talking to see if I could get anything near 4%. The closest the SBA website says anything not that the regular loan, if you're not looking for forgiveness, is capped at 1%. So I'm not sure where that financial advisor is getting that information. My guess is that it's outdated information based on previous SBA rules. This is a brand new program. Congress wrote brand new rules. So what you knew 2 weeks ago is not necessarily true today, which is awesome. But this is a question to ask the banks themselves, who are administering the program, not somebody outside of that process. If you get some portion of the loan forgiven, it appears that the rest of the loan will be at 0.5%. But again, that's something to check with the financial institution. And to go ahead and you need to apply and get the information today and not wait and be getting all this different maybe. Go to your financial institutions, get the application information so that you have facts at hand.
Great. Thank you. Question about what if a center is closed now but does not reopen in June as planned? Will they be penalized and have to pay the loan back?
So as long as you follow the rules for paying those costs during the 8 weeks after the loan is given, your payroll, your utilities, your rent and mortgage, and other allowable costs, your loan will be forgiven. It's those 8 weeks that matter.
Okay, thank you. Question confirming that family childcare, in-home childcare can apply for the Paycheck Protection Program?
Yep, they can.
Okay. I think this may have been answered. It's a question about childcare staff in a public school. They've been told that they do not qualify for earned sick leave since they receive that benefit from their regular job in the district. Yarrow?
So if I understand the question, if they're public school employees and they already receive earned sick days under state statute, then the earned sick leave law does not cover them. But if they have another job where they're not categorized as a public employee, then they would be eligible for it at that job, if that's the question.
Okay. There's a question about how to apply for the grant or paycheck program, which Danielle responded to with a link to the Small Business Administration with more information. Again, we're going to do a subsequent conversation, whether on Facebook or on Zoom next week, and may have more information on that. Can the SBA loan be used to pay for health insurance? For your health insurance that is not a group insurance plan?
So it's my understanding, and this you have reached the limits of my knowledge, but it's my understanding that the employer getting the loan, if they're paying the benefit, then it's covered. As an individual, you can't get a small business loan, so I don't think that would be covered, but I might not be understanding the question, and I might not be applying the what we know about the loan forgiveness program. So that's as far as I can go.
Okay. And moving down in the questions, I know, Danielle, you had an extensive answer, and I think you can all see the questions in the chat box that talks a lot about how to apply for loan forgiveness. There's a lot of detail in this. Again, we're going to pull these responses out of the chat box, put them together in a document which we'll post on our website. So you'll have that in a easily accessible place. We're also recording this, and we'll make that available on our website as well. Let's see. Yarrow, I think this is for you. Which paid leave benefit takes precedence? Those under Family First Act or those available under the emergency FMLA expansion?
Well, it depends on what someone means by precedent. I think the thing you have to be aware of in terms of earned sick leave, the state law, that employer has to pay without any reimbursement those 5 days. And then the reimbursement for those 10 emergency days, it has to be a qualified reason that I discussed, related to situations around COVID-19, they would get reimbursed through those payroll tax credits. And then in terms of the paid leave programs that we have in New Jersey, so family leave insurance or temporary disability insurance, the individual, the employee, is applying to the New Jersey Department of Labor to seek the wage replacement benefits. And the emergency FMLA, which is just for staff taking leave because their children's school place is closed, that would be through the payroll tax credit, which right now don't have the details of how that would work, but I think they're going to be released soon. So really you have to kind of figure all that out for whatever the individual's experience or situation is, I think. If that's, you think, answering the question.
Okay, and there were a couple of other questions that followed about a lot of confusion about unemployment versus Family Medical Leave Act. I think some of your PowerPoint addressed that, but as I've said, we'll take these questions and put them in an order that we can respond to and get them out on our website. I'm going to pause here because it's 12:28. We are a half an hour over our planned presentation because of all the problems we had getting on Facebook Live. I know Danielle and Yarrow committed. I'm not sure you're available for us to continue, and for how long, if you are.
It's up to you. I'm available for the next 15 minutes.
Same.
Thank you. I appreciate that. How about if I'm looking at the chat box. The questions have come in individually. Trying to group them is difficult. I'm going to skip a couple because I believe they have been addressed already. But there are a couple of questions about if staff were already laid off and you bring them back if you get the loan, how would that impact their eligibility for emergency and medical leave? And how will it affect the center?
Danielle, I don't know the question about if somebody's already laid their staff off and they bring them back, if they would then be eligible for the paycheck.
We believe if they bring them back, it actually says, that's what I was pausing. It actually says in the language, hold on, I'm trying to find it. Rehiring, you have until June 30th, 2020 to restore your full-time employment and salary levels for any changes made between February 15th, 2020 and April 26th, 2020. So you can rehire and then be eligible.
Okay.
And then once you rehire, there's, the expanded paid sick days and expanded FMLA. As long as it's a qualifying reason that someone needs to take leave, you could seek the reimbursement through the tax credits at that point.
Yeah.
Okay. Thank you. Question again that came up about a credit union that said they will not participate, which Danielle answered with some resources to go to get the names of financial institutions that are participating. Question about an independent contractor. Would this apply for expanded employment or regular unemployment?
Yeah, so an independent contractor typically is not eligible for regular unemployment, but with the expansion, they should be, yeah. But that is where they are just getting the half of what the average unemployment in New Jersey is, which is around 200, plus the 600. And right now, the Department of Labor is recommending that those individuals apply to the regular unemployment, likely be denied, and then hopefully by that point, they will have the process in place for how they would be put into the expanded unemployment insurance.
Okay.
Hi, my name is Adria Janney. I came in late. I was looking for your broadcast and I couldn't find it. But anyway, is this being recorded so that I can watch it from the beginning? I don't want to keep asking questions that may have already been asked.
Yes, it is going to be recorded. We will distribute it. Again, our plans were derailed because we had problems getting Facebook Live to work for us. I think it's an internet problem because we've had other problems this morning, not just us, the broader internet. So yes, this is being recorded. And we are going to group the questions and some of the response because both Danielle and Yarrow have responded to questions in the chat box as well as during the presentation. We're going to put that together. If there's a way to get this out to you individually, and I am not the person who can tell you that in my office, we will definitely put them on our website, which is www.acnj.org. So everything will be up there, including the slides that Yarrow presented.
Another question.
Can you hear me?
I'm sorry.
Okay.
Hello.
Hi,
What
everybody. If I could just interrupt really fast, if you could please all mute your lines and keep on writing your questions in the chat box so that way we can make it easier for our moderators. Thank you so much.
I'm having a hard time doing the mute.
Right on the bottom, and a microphone on the left-hand corner. A couple of questions about why would employees, I'm just going to read one, but there are a number of questions. Why would employees come back to work when they're getting $600 per week up to 6 months for staying at home? What if they don't want to come back to work?
So the just to be clear, the $600 is only for 13 weeks. It actually expires a date in July. I'm not sure the exact date. And I believe that what they would be doing if they didn't return is they would be risking losing that position. And that, I think, is a huge deterrent for people wanting to just stay out on unemployment. But I would have to research a little bit more kind of the legal ramifications for a worker beyond that. But yeah, it's limited to only the period up until July. 31st. Danielle, July 31st, I believe.
Yeah, July 31st.
And I would also add to that unemployment in this case is because you lose your job related to the COVID crisis. It's not because you quit your job, right? Which is an important distinction here.
Thank you, Danielle. That is an important distinction. I'm reading through the questions. Some of them have come up already.
I hate not to follow rules, Seal, but I can't.
Okay.
My mute the type in on my little iPad, and I'm multitasking. I'm emailing families at the same time. I'm Avisa B. Penniston from the Neighborhood Child and Infant Care Center in Montclair. I am open as an emergency child care center. I tried to apply for the loan through my bank, and they sent an email saying not to try currently because they're waiting for more clarification on how this will work. I'm concerned about my upcoming payroll, April 16th, with low attendance and low swipes. Is there anything or any place else that I should try and get a loan from?
So first and foremost, I would go back to them again and say, okay, when can I apply? Like they were told they should start accepting applications today. So if they're not accepting applications today, you need to understand why. That's the first thing. The second thing is, I think this is for SEAL and what the state is doing for providers that are currently subsidized. And SEAL, do you want to touch base on that one?
So I actually am not sure about that. We looked as we were on the phone, as listening to the conversation following the questions, we looked for written guidance from the state. It is not on their childcarenj.gov website. So that's something we're gonna have to follow up on. I think, guidance was put out yesterday about the emergency childcare, but a lot of it focused on the standards, and it also focused on rates and how individuals could identify themselves, individuals who are essential workers. I think what this is pointing out is there are many, many, many questions, many detailed questions, and some overarching questions that need to be answered.
And Avisa, I'm sorry, Seal, and Avisa,
please go ahead.
You can also remind your lender about the emergency loans that are available, the $10,000 grants that should be available within 3 days, and ask them how they're going to make those available to you.
Okay. If everyone is using the chat box, the questions toward the end have been answered. Danielle has put in, and Yarrow both put in answers to some of these questions. So I am looking to pull out something that has not been raised or answered in the chat box. I think we have covered, again, I don't think we have the capability of answering your individual questions, but I think we have covered the broad categories as best we can. A lot of this needs to be followed up on. I see a number of emails. Cynthia Soti, I see your email about this is true. There's so many detailed questions, and it's pointing out the need to have a resource to answer them, and and not just a website to go to, but somebody who can help walk people through this process. I think that there's some thought to developing that. but at this point, we don't have answers on that. In the 5 minutes we have remaining, I'm going to ask if anyone has any, and we'll open it up one at a time if we can do this. If there's any pressing question that has not been covered in the discussion or in the chat box. Again, in looking at your questions, many of them are very individual. So we've provided some broad information. Some of these I think would be difficult to answer. And also Danielle has put a lot of answers in here with resources that you can go to. So is there anything pressing that remains? Again, this is the first time we've done this. It's been a lesson learned for us too. And to me, the lesson learned is that there has to be a better way to communicate to all of you who are out in the communities, trying to serve your families, trying to stay in business, and simply a website is not going to do it. So from an advocacy perspective, we commit to following through both with your questions as well as following through with what's the state going to do to create a communication system where you can go to get answers. So anything pressing that anyone wants to ask, we have 4 minutes left. So I'm gonna ask the ACNJ staff. I think Eloisa had something in here about how we could share the information. Would you mind telling people how we will be able to do that?
Hi, everybody. This is actually Catherine Flakey from the ACNJ staff, letting you know that we are actively recording this session and we will be sharing it. It's probably going to be a YouTube link, and we will also be sharing it on our Facebook page. So again, we apologize for the technical delay, and we hope that you join us in the future for any Facebook Lives or Zoom meetings that we do hold.
Hi, this is Eloisa Hernandez. Just remember our Facebook page, there's a link there for a feedback form. We want to know, what your thoughts are about, this webinar, and if there are any future topics you think we should consider.
Great. And for me, this has definitely been more questions and really points to the need for more information to all of you who are doing this in your communities.
Hi, Seal.
Yes, Juan Carlos.
Hey, how are you? I just wanted to comment, the Assemblywoman was on. If there's any way that we can help in forwarding inquiries, please let our office know.
So Juan Carlos Nardello is the legislative aide to Assemblywoman Yvonne Lopez. And Assemblywoman Lopez and Senator Vitale have really taken the lead on putting pressure on the governor's office and the department about resolving the issues related to childcare. I want to thank the Assemblywoman and the Senator for doing that. And he means it seriously. They do follow up. So again, this has been a learning experience for all of us. I appreciate you being on the phone. We had almost 135 participants at the height of the call. I thank Danielle and Yarrow, and also for staying on longer because of our technical difficulties. We'll get better as we go along. And again, we're committed to getting the information out to you. And one last thing, the census. This has also derailed people putting in their census information. Please urge your families, your staff, whoever, to take the census. We want to ensure that New Jersey is ahead of the rest of the country in the census responses. This past Wednesday was Census Day. We saw an uptick in people who filled out the forms online. We have to keep that going, and all of you can do that. Again, if you want to check out the ACNJ website, www.acnj.org, we have a census page with activities that you can do, information to share with you. We also have another webinar planned for Monday at noon. I think we're going to try Facebook Live again. We'll see what happens. We'll be better prepared to make the shift if that's not working, but we do have someone from Business and Industry Association coming on to talk specifically about the small business loans, and also Kim Pirelli, who heads the ChildCare Aware New Jersey, which is the organization of the childcare resource and referral agencies, to go over some of the nuts and bolts as far as she knows around issues of closure and continuing to pay for subsidy, as well as those of you who stayed open for emergency care. So we'll get an email out around about that, and we'll have a little more detailed information. And we have more planned. Your questions have helped us focus on what we need to do. And I'm just going to close by thanking all of you for what you do. As I said when we started, this has been an incredible, I don't think any of us ever anticipated what would happen. The positive is that I think the rest of the world now understands in a different way the critical importance of we really need to build on stay in business, and that we can have a strong child care system moving forward. Because as everybody talks about the economic recovery, it's not going to happen without childcare. So let me end there and thank you for what you do. Check out our website. We're going to get the information out to you. Check out our website for upcoming webinars as well. And again, thank you, Danielle. Thank you, Yarrow, for participating and staying on, and also to the ACNJ to make this work, because this was a challenge for all of us. Thank you all very much.
Bye, everybody. Thanks.